Kim's sent in a question about babies with tongue tie. Is there any correlation with, she's asked about difficult births or fast births? What might be the origin of a tongue tie? Do we know?
So having the actual tongue tie isn't related to birth because it's something that happens, with the embryo and the development. It isn't affected. There is something called faux tie, which means a false tongue tie, whereby oral function is affected and tongue function is affected. And that's what I'm seeing. So people might say the baby's got a posterior tongue tie, but on full examination, actually, it's the forceps birth that has affected the baby. I see quite a lot of retracted jaws. And again, torticollis because of potential forceps. The other thing we're seeing is because there's such a high caesarean rate now, it's about 50% of births are planned caesareans and emergency caesarean, so very, very high. These babies aren't going through the normal birth process. And by not going through the normal birth process, that affects their physicality and can affect oral function. But it
right,
doesn't.
so it's not going to cause a tongue tie, but it might mimic it because of the structural effects of what's going on there.
Yes.
Well, my daughter-in-law had a C-section last night due to failure to progress. It wasn't elective. So, yeah, I'll make sure that when these things do arise, as they may, then they're aware of that. So what are the degrees of tongue tie? Because Adam talked about a severe tongue tie in his child, his son. Mm-hmm. Are they graded, or is it just a sort of an eyeball of how much of the tongue is actually tied?
So over, the last probably 30 years, there have been different classifications. So you will, depending on what research you're reading, which practitioner you're talking to, you might hear 100%, meaning, so if you've got the tip of the tongue and the bottom jaw, 100% would be from the tip to the jaw, then 75%, 50%, and then what people call posterior, which means it's towards the floor of the mouth. So sometimes you then hear someone saying it's a severe tongue tie because it's 100%, so it's tip to gum. Might be called severe, and posterior might be called mild. But in actual fact, in terms of function, some babies that have a very, very visible frenulum may actually be feeding well and have reasonable tongue function. And a baby that has a frenulum that's attached further back may actually be having more problems with feeding. So language-wise, we're trying to get away from talking about, anterior and posterior, and just saying it's a tongue tie. So tongue tie means a restrictive frenulum that is causing functional issues.
That's interesting. I mean, I'm struggling to grasp how a posterior tongue tie could cause greater problems than a severe 100% tongue tie. Can you explain that?
Yeah, so
if it's the tongue tie that's causing the problem and not structural problems otherwise.
Yeah, so I think it's always multifaceted. I very, very rarely see a baby where everything is fine. We just need to release the frenulum and everything's fixed. There's always positioning, there's always management, helping the parents understand feeding cues and timing and that kind of thing. In terms of how can the more severe or anterior tongue tie be worse, it depends how stretchy the frenulum is. So what we're looking for is the tongue to have like a peristaltic wave, because the tongue needs to come out and grasp the breast tissue. And some babies, despite having a very visible frenulum, can still do that. They can hold the breast tissue in place. It might be pain-free for the parent and therefore not causing a problem. Because you've also then got the other component, which is the mum, with a more mild or posterior tongue tie that doesn't appear to be so bad when you're looking visually, it may actually be causing more functional issues, and perhaps the tongue is sort of, just doing an up and down motion and unable to do the peristaltic wave that we're looking for.